Hi, my name is Alan. I'm gonna teach you what we're gonna be handing off, what we'll be saying and showing our co-nurses when we are giving them a report or a handoff. So I'm now on the patient screen, and I'm gonna show you where it can be accessed. So if you're giving report, just go to the S bar handoff, and for CCU people, we use the CCU S bar handoff tab. So these are all called tabs, remember? So we're gonna click on the CCU S bar handoff tab. So when you get to that screen, you get the face sheet, the order list, instructions notifications, and the conditional orders. So we'll go first with a face sheet. Um, if we'll expand on it, we'll see that it's a tab on the face sheet has its own data. So we'll go through them one by one when you're giving reports. So like for this patient, SVICU Alan has a past medical history. Actually has no past medical history, so no prior illness, surgical history, there's none. So you can just go through each information as you are giving report. So uh, all these informations are pulled from the assessments and documentations that has been done by previous nurses in this with this patient. Um, then we'll click through each one of them. Clinical data are the latest vitals and most current uh, lab works, lab results that has been done on this patient. Then for shift review, we got the um, latest assessments that has been done, latest information like height and weight, and level of consciousness, or the last time the pain was assessed, and then if patient was on fall risk. So it's all on this tab. Physical status, it will pull the patient's orientation, level of consciousness again, monitor it's the rhythm and what heart rhythm was in there, bed sounds, accretions, and all those stuff. Vent settings, if the patient is on vent. Tubes and drains, if there are any tubes and drains that are on the patient. Then we have the S bar, if for within that previous shift there was an S bar utilized to call the doctor or call the family. ADL is an assessment of the patient's activity and as well as the ability to perform those activity, if there is a need for assistance or not. So all this again are being pulled from the previous documentations of the nurse. Admission health history, I think we have that as a medication allergies, if there's any. So this one has an allergy on penicillin, and so again, these are just pulled from the documentations that was done earlier. So in this tab, we can find flu and pneumonia vaccinations status of these patients. Um, then this one is the reg and visit info. It has the date of admission. It also shows if there is an advance directive, and it will show whether the patient's code status has been addressed. And on this part, we will see which is the contact information that the patient has given for us, so that we, let's say, if they prefer to have their family member to be called, so we have that on this tab. So that's the face sheet. So we'll move on to the next one. The next is the order list. The order list would comprise of all the orders that's active, or all the orders that has been ordered on this patient. So it can be separated by medications, lab, radiology, tubes, and all the rest. So just go down the line, and it can also be just put on what is the active one and the one that it could be all. So it would, if you put in just the active one, like that, and put in for the current visits, meaning just the this admission, you put in as the current, and then update list. It will only show you what has been ordered and what is active at this time. So that will show you the list. But if you put in for the all, it will show you all. So it will show you all that has been ordered for, including the previous visits that this patient has been. It may take a longer time to load though, because it would be loading in more information into the system. And then again, it will divide itself as per category, as in medications, laboratory, and radiology, and so on. Okay, so we move on. Next would be the instructions and notifications. This one is just a list of, again, it's just like the order history, but just it brings out the list of instructions. Oh, hold on.